Hey guys, welcome to my channel. My name is Memocano and this is MC Productions. Today I have a lesson for y'all. Something that we went over quite a bit in medical school, but I've been going over it and I'd like to share it with you guys. Today the topic is STDs or STIs, and we're going to do particularly chlamydia. I currently have a patient who I believe has an STI. Right now he's getting tested, and hopefully we can get him treated promptly. But anyway, let's get back to the topic here, chlamydia. I'm going to try to go over the history and physical, the findings, the diagnostic criteria, and okay, 3, 2, 1, action. Hey guys, welcome to my channel. This is Memocano from MC Productions, and today I have a lesson for y'all about STDs. We went over these in medical school quite extensively, but currently I have a patient, or there's this patient that I'm dealing with that I believe has an STD. Right now he's getting tested, and once he gets tested, we'll treat him appropriately. And so these are quite common, especially here where I live. HIV is pretty common, but today the topic that I'm going to be talking about is chlamydia, which is the most common STD in the United States. I'm going to be going over the findings, the history and physical, differential diagnosis that you want to be considering, and the diagnostic criteria, as well as treatment and complications. So let's begin. So, like I said, it's the most common in the U.S. The findings: it can infect the urethra, it can infect all of the urogenital tract, but it can infect the urethra, the anus, the eye. For those of y'all in pediatrics, it's one of those conjunctivitis, chlamydial conjunctivitis that you want to keep an eye out for. And of course it can coexist and it can mimic gonorrhea. So we're going to go into the history and physical. In males, it's largely asymptomatic. There's definitely more severe symptoms in the females, but there can be, like it says down here, some penile discharge, some testicular tenderness that you want to keep an eye on. Now the discharge for chlamydia and gonorrhea are quite different. I will likely go over that in the gonorrhea video. But in women, you're going to find urethritis, mucopurulent cervicitis, so you might see some pus in the cervix, and some PID here. On the exam, it's like you could likely find some annexal tenderness, some cervical tenderness, and things of the sort. Lymphogranuloma venereum is a finding from, there's certain serotypes of the chlamydial bacteria that can cause lymphogranuloma venereum, and there's multiple stages to that. There's primary, which is just an ulcer, shallow ulcer. There's secondary, which is inguinal node swelling, so swelling in your inguinal node, lymph nodes. And then tertiary, which is the most severe, is anogenital syndrome. You can find anogenital fistulas and even elephantiasis in that. And so you might be questioning, what should my differential diagnosis be for this disease? And I have a list here. PID is one of them, pelvic inflammatory disease, orchitis in men, endometriosis in women, and again gonorrhea. Vaginitis and just a simple UTI should be on the differential diagnosis, and you go excluding things based on the clinical symptoms, on the history, which takes me over to the risk factors. Risk factors for chlamydia is going to be multiple sex partners. If they tell you, I've been sleeping with 2 or 3 or 4 people or more, there's really no limit to that. You want to be thinking about a possibility of chlamydia. And another risk factor is unprotected sex. So when you're asking the sexual history and ask, have you been using contraception or condoms or other methods of sexual protection, and if they tell you that they haven't been, then you want to be considering chlamydia as one of the options for the syndrome or the infection that you're dealing with. Okay, from here we're going to go into the diagnosis. This is the questions you want to be asking: is what test do I run, in order to make sure it's chlamydia? And first off, it's clinical. You're going to want to look for these signs on the physical exam, on the history, looking for those risk factors like we mentioned. But then once the clinical is done, you want to make sure. And the gold standard for that is a culture of the secretion, a urine culture. And so there's multiple tests here: the urine test or the NAAT. That one's a little faster. You can do a DNA probe and immunofluorescence, which takes about 48 to 72 hours. And in the gram stains, when you're looking at the gram stains, you will likely see neutrophils, but you won't see bacteria because they're intracellular. So this is guys. So for the treatment of chlamydia, we're going to have doxycycline for 7 days. And it's antibiotics, obviously, for bacteria. So doxycycline for 7 days, or azithromycin once. I'm guessing that's like a shot. It might not be, but azithromycin once. If they're pregnant, you want to do azithromycin or amoxicillin. You want to treat sexual partners as well. You want to have a low threshold for a possible co-infection with Neisseria gonorrhea, and we'll go over the treatment of Neisseria gonorrhea in the following video. For the lymphogranularum veranum strains, you want to have a prolonged course of antibiotics, 21 days, in order to get rid of the infection. Now for complications, these complications are quite severe. If you allow these infections to keep going, they can make quite a mess in your reproductive organs and in your urogenital tracts. So you're going to have Reiter syndrome. Reiter syndrome is a triad, a combination of urethritis, inflammation in the urethra, arthritis, inflammation of the joints, and conjunctivitis, inflammation of your conjunctiva in your eyes. Now, you can also have Fitzhugh-Curtis syndrome, and Fitzhugh-Curtis syndrome, I remember first learning about it and seeing a picture, and basically in the liver, there's liver fibrosis, and it forms like strings up into the, I'm guessing the omentum or the wall of the abdomen, because of the fibrosis. So perihepatic inflammation, you have inflammation of the liver, of around the liver. Maybe the capsule, Gleason capsule comes to mind, and I might be incorrect. And you have fibrosis. And another major complication, of course, is PID. And with PID, you have increased risk of infertility and increased risk of having future ectopic pregnancies. So, guys, this was chlamydia. I hope you all learned something. Please like and subscribe to the videos, and subscribe to the channel, and let me know down below of any topics that you guys want to learn about, or if you learned anything in general about this topic. Peace.